Assalamu alaikum. Can you all hear me?
Assalamu alaikum, yes.
Assalamu today's session is basically on question and answers on Sharia, on Islam, or on medicine. So whoever wants to join us, they can either ask specific question or general question. Otherwise, I will probably talk myself at the start. So any questions at all to start with?
Not a health question. I remember you mentioned something about wearing clothes in the bathroom. Whilst having had a shower, can we make our wudu then? Or do we have to make the wudu once we put the clothes on? What is valid?
You make wudu providing you don't say the names of Allah Azza wa Jal loudly.
Okay.
So you say the names of Allah Azza wa Jal in your heart,
Yeah.
and the intention obviously, and you make wudu. And advisable after every shower you finish by wudu, because
Yes.
more likely a person would clean his private parts and things, and that has in some madhahib you have to repeat your wudu. In some madhahib is not, because they take from the hadith of the Prophet is part of you. Because that hadith, a guy asked the Prophet ﷺ, do I have to renew my wudu if I touch my privates? He said no, because it's part of you. And what benefit we get from that answer is you do your wudu, you do your ghusl, you do your shower, you do your wudu, and while you're drying yourself, you might accidentally touch yourself. Yeah. So that will be under that hadith, that you haven't lost your wudu.
Okay.
Yeah.
Okay. It's fine. Exactly.
Any more questions? If you don't have questions, I'll probably myself mention something to pass the time while we get more questions. We have been talking about Aqidah the last week. Alhamdulillah, it's Monday to Friday, so we don't have sessions on Saturday or Sunday. But I noticed whenever you see something strange in a group of people, you start thinking about why they're getting it wrong, where in Aqidah they fell short. So when I was looking into Aqidah and looking into a group like Qadiani or Ahmadi or Baha'i, in the Quran, Allah Azza wa Jal said that Muhammad Sallallahu Alaihi Wasallam was Khatamun Nabiyyin, the seal of prophethood. And they came and claimed to have a new prophet. So obviously they clashed straight away with the Quran. They don't think if they clash with the Quran is a major issue, but it is. Because according to Aqidah, you have to accept that Allah Azza wa Jal is the most wise and the most knowledgeable, and Allah Azza wa Jal is already, He is aware of the future. So if there's any changes going to happen in the future, Allah would have included that and made provision for it in the Quran in advance. If we don't accept that, either they reject that Allah most wise, or they reject that Allah most knowledgeable, or they reject that Allah knows the future. When they reject that Allah knows the future, the whole religion become invalid. Anybody can tell me why? Why become invalid, our religion, if they reject the future? We have Muhammad Sarwar, we have Amina, we have Simi, and we have Brother Arif. I don't see pictures, but you can talk. If anyone has an answer, why if you disbelieve Allah knows the future, the whole religion becoming nil and void. There's no point in religion.
Because Allah states that in the Quran, and He talks about the future.
Yeah, and what significance is that? Why we have to believe in the future? Because I'll cut it short for you. Because the main pillars of Islam, of Iman, is to believe in the hereafter. The hereafter is something we're told about what's going to happen in the future. And if you read the Quran, it's always man amana billahi wal yawm al-akhir, man amana billahi wal yawm al-akhir, whoever believes in Allah and the day after. And he included Christian, Jew, Hindu, Majus, whoever. If they believe in Allah and the hereafter, then there is a rethink about their position and condition. And if you don't believe in the hereafter, there's no accountability. There's no point in avoiding haram and doing halal. So if you can't get away with it, you don't need religion. And that's what the kuffar is. The kafirin, the unbelievers, they think they can't get away with it, they will do it. If they get caught, they pay for it. But we as Muslims, even if you don't get caught, you are going to be accountable next life. Otherwise, many people will get and checked. Like Jimmy Savile, who abused so many children, and he died before he was punished. Now, many of those abused, they were angry because he got away with it. We as Muslims say, no, he hasn't got away with it. He will be brought into account by Allah Azza wa Jal, and he will be punished for all what he's done. So for us, we're not worried at all, because like in Surah Al-Buruj, Allah Azza wa Jal said, the people of the Ukhdud, they were killed, all of them thrown in a fire. قتل أصحاب الأخدود النار ذات الوقود هم عليها قعود وهم على ما يفعلون بمؤمنين شهود وما نقوم منهم إلا أن يؤمنوا بالله العزيز الحميد. They only killed them because they believed in Allah Azza wa Jal. It's like I've sent yesterday a news item on the chief executive of Ryanair. 5 months ago, he said that all Muslims are terrorist suspects, and they should be checked before they are allowed to planes. So subhanAllah, the news item yesterday, 99 of his planes are grounded, and he's going to sack 3,000 of his staff. So it seems as many of them, they get the punishment from Allah sooner or later. And we don't know, even if they die, we don't know whether they are punished or not, but definitely Allah will make sure people who harm others get punished in this life before they die. So Aqidah, straight away, when you look into the Ahmadi, Qadiani, and Baha'i, they clash straight away with what's in the Quran, plain mentioned in the Quran. If Allah wanted another messenger to come or another prophet, he would have sent. And he guaranteed to preserve the Quran. Allah said, Inna nahnu nazzalna dhikra wa inna lahu lahafidhun. Verily, we have sent down the revelation, and we will be preserving it. And the Quran, alhamdulillah, has been preserved. The last 1441 years, not a single word taken out, not a single word added, and nothing has been changed. I've just heard a message and a short video in Arabic. That's one of the ambitious Jewish people went to a Muslim city once, and he thought he has all sort of wisdom and ability to argue, and he could embarrass the scholars in that city. So before he arrived to the city, he met a shepherd, and he stopped. He thought, I'll try this shepherd because he's a lay person. He doesn't need no money. So I'll see if I can shake his belief in Allah. So I came to him and he said, look, we are Muslims, and we love Islam, we love God. And he pretended to be Muslim. And then he said to him, we have difficulty memorizing the Quran, isn't it? He said, yes. He said, I always thought that there's a lot of similarity in the Quran. There's ayahs, but they are similar to each other. So now, why don't we remove all these ayahs which are similar and and then we will have smaller Quran. We will all be able to memorize it. He said, you're saying really nice words, you're really great thinking, and you're really wise. But I have a question to you. He said, yeah, what is it? He said, you as a human, you have a lot of organs similar to each other. You have two arms, probably you can do with one only. You have two eyes, one eye will be enough. You have two ears, one will be enough, and you have two legs, one will be enough. So why don't we chop off the things which are extra in your body? Ahlan, Dr. Mudasser. Chop the extra organs in your body which you don't need, and then you will be lighter. You will be able to jump and go and whatever. Now, organ donation, come and say you have two lungs, let's say a part of the lung. People say no. You have two large liver, we'll take part of it. People will say no. So this Jewish guy said, oh my God, if this is the lay person I couldn't defeat, how would I defeat the intelligent one? So when it comes to Aqidah, subhanAllah, Aqidah, when you see people deviating from Aqidah, like Shia, the Shia, they say, only 6 Sahaba remained believers and the rest left Islam. And including Aisha, including Abu Bakr, including. And then when we read the Quran, Allah just said, الطيبات للطيبين والطيبون للطيبات. The pure will marry pure men will marry pure women, and pure women will marry pure men. So Muhammad sallallahu alaihi wasallam, pure, he married pure Aisha. They said, oh no, they didn't. She changed after he died. Then they clash straight away with Allah knowing the future or not. They clash straight away. If Allah doesn't know the future, how would he say there will be day of judgment? So they clash with a series of beliefs in the Quran. So Allah is not the most wise. Allah is not the most knowledgeable. So they take themselves automatically out of Islam on an Aqidah basis. Our scholars, they were polite enough not to negotiate religion with them this way because they don't like to take them out of Islam. We don't like to take anybody out of Islam easily, unless he himself took himself out of Islam. But they are acting sometimes in a very, very savage way, in like killing Muslims in Syria, in Yemen, in Iraq, in many places. That I think this time is probably right now to come and say, look, if you carry on believing like this, cursing the Sahaba, you're clashing straight away with the Quran, clashing straight away with the Aqidah, and that contradicting major beliefs in Aqidah might take you out of Islam. So this is what I think. Any more questions? Do you have any questions? We have Dr. Mudasser also to answer some medical questions. He's officially a doctor now in the right clothing, uniform. What we did in the absence of questions, we are answering questions we create. Yeah. So if you want to create your own question, then answer it.
There's a lot of like misinformation, misconception going on at the moment with the current COVID. Because with other groups, I've been asked a few times some questions about people being labeled COVID, that they have died on the death certificate wrongly. So that everybody, whoever is dying, is being labeled as a COVID on the death certificate. I mean, that I can only tell you by personal experience that that's not right. And it's a legal document, so nobody can do that. Nobody would do that easily. So I don't think there is anything like this going on. So I think we should probably try and keep ourselves away from any of these conspiracy theories, because there's like on social media and in communities, there's a huge amount of conspiracy theories going on. And I think we should probably try and keep ourselves away from it, just keep to the facts. And the facts are that it's a virus which is new and we are struggling to manage. And there's a lot we don't know about it. So that's why the death rates are quite high.
Yeah.
And because it is affecting the most vulnerable people the most, and the most severe, so unfortunately, people are dying with it. So it's not just a conspiracy or anything.
One of the things which has been in the media that many people are afraid of going to hospital. First,
that's
because they
true.
don't want to be to catch the coronavirus. They think that the hospital is just full of virus everywhere. So many people died from heart attack at home. They could have been saved. And there were 70% drop in the cancer cases being referred to hospital as well. And late diagnosis sometimes could be a killing mistake. So people should actually go to hospital, phone the ambulance. They are expert enough to first send an ambulance which wasn't carrying coronavirus, and if they were carrying, they will definitely clean the ambulance from any traces. So you need to tell this message. Everyone who has have elderly around them, and people who could get chest pain, who could get um, uh, signs of neuron disease and hemiplegia, or loss of functions of limbs or whatever, they should actually go to hospital. And,
Yeah, I mean that's what I've said to the whoever's been asking me that. I mean, look, yes, hospitals have been, but to be honest, COVID it has settled down quite a bit in the hospital setting. Yes, as a whole number and all those which we are seeing on daily briefings doesn't seem like there's a huge difference. But in hospitals, we have seen a huge difference. So the admissions and the total number of patients have reduced, and the new patients coming into hospital with COVID symptoms have reduced a lot. So we are slowly going back to our normal daily activities, doing the clinics, because at the moment all the clinics, everything is being suspended. So it's just mostly COVID and nothing else going on in the hospital, which we are slowly coming out of it now. So the rota has been changing. Even like all the consultants have been doing days, 12-hour day shift, 12-hour night shifts. So including myself. So we've been doing shift patterns like 12 hours day or 12-hour night.
Yeah, this is my daughter-in-law doing 12 hours shift, 4 days in a row, and then 4 days off.
Yeah, that's
yeah,
the same rota which we are doing.
Yeah, there is one thing I really wanted to phone the media and speak about. They every Thursday they go outside and they stand up and clap all over Europe, and we missed it many times. Once we were praying Maghrib, and once we were, and then we were asleep actually. I had a nap on Thursday. I didn't go out. The Thursday before, my son came with his wife, and we were clapping outside. I want to phone and say, if you value NHS, please stop complaining against us.
Yes.
Because they are making all sorts of complaints just for the sake, hoping they will get compensation. They get £1 million, they get 2 million. I mean, one of my patients went and complained just 3 months before I retired. She complained that I saw her 40 minutes later than her appointment. And I said to her, you are much lucky than the people in Ethiopia and Pakistan and Bangladesh or whatever, and you shouldn't be grumpy. And then they forced to investigate. So they appointed somebody to investigate and talk to me and talk to the staff. Apparently, I saw her 5 minutes before her time, because she didn't know on arrival, they will mark on computer when she came, and then they will mark on the computer when she went in. And I start writing on the computer straight away when I see her. So everything is being documented. She didn't get away with it. She was told to get lost. But many people actually succeed. Like one of our friends now, there's 200 cases against him. He operated on people that didn't need the operation. So there is so much clever, sinister solicitors who will say, complain or will get you some money. and then compile a lot of cases. To go back and talk about a person had like a knee replacement or had mastectomy or has something this or that, and it's not going to be easy. What this Robertson, who was in the hospital in Solihull, it took around 15 years before they finished all the cases and before they settled. And many people like this, they just forgot now that they were complaining against us day in, day out. There's one in Wales, he bought a book on Islam. I didn't even know that this book exists. And he went and complained against me that I was trying to convert him to Islam. And he's hoping that, you know, just foreigners in the middle of North Wales, and people might think that. And I'm active Islamically. I have a lot of work in the mosque and the community. We had interfaith meeting with non-Muslims. I was in the media, so I wasn't like, you know, somebody who's can easily say I don't talk about Islam or I'm not practicing. No, I'm committed. He didn't get far with that, but he tried. So they really need to address that.
Yeah,
We have Khaled now joined us. Do you have any question, Khaled? Khaled, can you hear me? Any question? Or from Simi or Muhammad Sawa or Brother Arif? Or shall we carry on?
I haven't got it.
Yeah. One of these things is just to think about it. The things which is, it's really, it must be, the virus must be from Allah, must Allah allow this virus to spread, because we have been talking about global warming for the last 20 years. And in just one small virus, Allah changed the global warming. I've never seen 6 weeks in a row where you feel there is spring. When I came from Syria to Britain, the spring thing's gone, doesn't exist. Always clouds, always rain, always different, you know. While you see proper spring, the air became a bit clean. Allah grounded all the planes, all the trains, all the cars, all the companies closed and everything. So he changed the global warming.
Yeah.
I don't know. I mean, that's.
Oh, no, that's actually true. Means I was watching this documentary, and it's showing I think the nitrous oxide measurements they were doing to check for the pollution, and it is on a record low in all big cities, not just UK. Means in China, France, Italy, US, everywhere. So it's actually a record low at the moment. So the
Clean
pollution.
air, yeah. They show that pictures from China used to be gray. Now it is pure, it's clean. Now, another thing came to my mind. Allah wants people to give the poor the money. Many people, especially elderly, they choose to go on expensive holidays. They go on a cruise liner, spend £10,000 for a couple of weeks, and now it's going to take probably 5-10 years before they start going on cruise liners. You will need a new elderly generation who will forget about catching the virus, and they are high risk, to go and live in a place with another 3,000 people. And if a virus appeared, they got stuck in the sea for 2 months. They couldn't leave the ship, and they didn't even have food. One of the cruise liner, they ran out of food because they take food for the 2 weeks, and then where the food will come from. So that's addressed by Allah. So you don't need these expensive holidays. Many of us, I mean, they go on holiday 5-6 times a year because they have good pension and they don't know what to do with the money, and they go and spend it. The last thing to think is actually spend on the poor and the needy. And so virus is just like you hit 2 birds with 1 stone. Allah Azza wa Jal hitting like millions of birds with not even a stone, a virus, a small virus.
Means subhanallah, means it has to, well, we can't really say that it must be, because we know that it is definitely from Allah. Where the thing is that there's so much going on, and especially some of the leaders, and I will mention Trump especially. I mean, the things which he come up with, in his briefings in the probably the strongest stage which can somebody have at the moment. So he's the president of the strongest, and he comes on the stage in the briefings, the official briefing, and talks about this is disinfectants being used to cure. So can we inject them? And so things like that. And then he comes and say, "Oh, I've got evidence that this is the virus has been made in the lab in the Wuhan." And now all the secret agencies are like, why you say that? I mean, where did you get this information? Now everybody would think that we have given you this information, but we haven't. So it's beggars believe how things are going, and as people are actually coming up with all these.
But then they say
silly
they paid the virology lab in North Johan $3.7 million in 2014 to run a project on virus.
Yeah.
What was that project? Why America paid China 3.7 million to run a project on virus? Now there's, if you saw Mary Poppins film, a spoonful of Clorox make the medicine goes down. A small spoon of Dettol makes, and then I saw the song today. The song and saying they replaced the sugar by Dettol. I mean, and then by the end he's lying down dead. You know, they put the name of the patient on the big toe, and his name on the big toe. He made the medicine goes down, and the person died.
Now, with the Federal Agency of Poisons, there was a news that they had to actually announce official statement in America because after President said what he said, people start calling, oh, is it safe to use Clorox to inject or to ingest or all of those things? So they had so many calls.
Yeah.
They had to actually announce and give like an official statement that people to look, don't use it. And I mean, there are people with all sorts of intellectual level, so yes, he might have said later on that, oh, I was sarcastic. I don't think he was, but say for argument's sake, yes, he was being sarcastic and he said that. But not everybody will take it as sarcasm. They will think, oh yeah, that's probably he's saying it. So it must
No,
be.
they showed him the videos that no, he wasn't sarcastic. And then one of the reporters said to him, "You said you were sarcastic, but you turned to Deborah, this lady sitting there, and you questioned that with her. Were you sarcastic towards her?" And he was so angry with that reporter. I said, "You for fake news or whatever." What's one of the things? I mean, we have to question is there is a lot of suggestible people. Hypnotics, psychology. We use hypnotics to hypnotize people, and you can only hypnotize people who are suggestible. I mean, I move this in front of your eyes, and then I want you to believe whatever I say. And there's people who will they wouldn't believe you for a second. And there's people who are suggestible, and they could be cheated, like, yeah, this could work, and this could be this and that. There's quite few of them, and this is why what you're saying, that 100 call received by one of the state governors that, the president said, should we use it? And so, subhanAllah, I mean, there's a lot of misleading. There's a lot of cheating on the leaders level. This is why the virus came to teach mainly the leaders, because the Russian leader said, no, virus is not in Russia. We have very clever doctors and very good hospitals. And yesterday they had the highest number of deaths so far. So it's still climbing in Russia. So this arrogant, leader there is just Allah teaching him a lesson. Yeah, we have Saeed and Khalid and Muhammad. We haven't heard from you. We need questions, medical questions or religious questions, before we carry on talking politics. Anyone? We have 10 minutes left, so we need to
Yeah, I mean, if there is anybody who's got, who has probably received similar WhatsApp message or any misconception or any of these conspiracies,
there were there
that can
were there were
more.
a news item today in Pakistan. There is a big scholar who was talking to Imran Khan, and he was saying, "You all lying about the virus. Nothing called virus." And
No, no, that's no, actually, the scholar actually was making a dua for the whole nation, and as a, like istighfar, that this is a pandemic came from Allah and we need to do istighfar and all of that. But he said liars to the media. He said the media always lie. So, and then the media just went against him. That, oh, how dare he says all the media is a liar. So
what's his name?
he's
Bilal.
from,
His name Bilal or no?
no, no, his name is he's a Tablighi Jamaat. He's Maulana Tariq Jameel. So he's
Right.
quite famous. He's world famous. He's like one of the top in the Tablighi Jamaat. So they go all over the world. And
Was he against the lockdown or was he?
no. There was nothing. He was just having a discussion, and they were talking about the whole thing. But and then he just mentioned that this media tells a lot of lies, and then he said, I won't name the name, but there was a media, one of the media houses boss. I met him,
In
and he
Sweden,
said,
they didn't have lockdown in Sweden, and I know many mosques in Pakistan and in Arab countries, they ignored the lockdown and they have been to mosques. It will be interesting to see because Sweden did that, and they don't seem to have much spark in death. I
oh no,
don't
but
know.
you say like there are lots of countries which are doing it with like testing and tracking and all of those things, which we didn't. We didn't test most patients, and I mean that's my personal opinion. I know that scientific people are doing it their way, and they must have reasons for whatever they did. But I think we didn't test enough people to start with, and track the progression of the disease. So if we have done the testing and tracking from the beginning, like South Korea and other people have done, I
Yeah.
think things could have been better, which we didn't. So
Yeah.
unfortunately, it was spread in the community very quickly, and at that stage, testing and tracking would have been useless.
We have Sister Nasreen joined. You muted.
Assalamu alaikum, Doctor.
Yeah.
This is
Have a question.
yes, Dr. Saeed here. How are you?
Alhamdulillah.
I got a couple of questions just quickly, Doctor. One is related to the asthma inhaler. I understand it doesn't subnil or break your fast. Is this is a case, and what is it based on, please?
It's based on وَكُلُوا وَاشْرَبُوا حتى يتبين الخيط الأبيض من الخيط الأسود. And inhaling steam, inhaling smoke, inhaling your inhaler, inhaling perfume doesn't break the fast. Doesn't go to the digestive system. It goes to the chest. And the scholars, they don't want to accept inhaler doesn't break the fast because they were adamant smoking break the fast. While if you are behind a car, producing smoke, or you are in the bathroom with a lot of steam, they all agree you don't break your fast because you are not eating or drinking, you're inhaling. Inhaling is not eating. So those who still insist that inhaler break the fast, I think those who are worried, if they say it doesn't, then the smokers will come and say smoking will not break the fast. But in Islam, smoking kills. So smoking is a poison, and you're not supposed to take smoke cigarettes because you are smoking, inhaling a poison. So the majority of Muslims now, scholars who know anatomy now, and they have enough medical knowledge, they agree that yes, inhaler doesn't break the fast. The second question?
Jazakallah. The second question is, there was a claim, though I don't think it was scientifically substantiated, that fasting would temporarily lower the immune system. Do you have any information on this or any?
The information we had, I mean, I'm asked Dr. Mudasser in a minute, that if you fast 16 hours 3 times a month, you actually boost your immunity. Now, we don't say that fast is brought to us because Allah want to improve our immunity, because we fast in Ramadan in winter. We only fast 8 hours. So it's not, I don't think it's related at all. I mean, what do you think, Mudasser?
Yeah, I mean, it's true. Actually, lots of scientific studies shows that body actually goes into healing phase. So that's what they use the word. So once you stop eating and drinking, so the body actually stops the atrophy and then kind of starts repairing the cells. So the body starts repairing cells. So it goes into the repairing mode. So there is no evidence that it will reduce your immune system.
If any, it could increase it.
Yeah, it probably will increase the immune system. But saying that, we just need to be careful that if somebody has got serious medical conditions, then they need to be, they should not fast if that's been suggested by their doctors for any good medical reason. Or if they are fasting, they should always try to have sahur and iftar. So they should not miss sahur and iftar.
And you mean, usually people who have poor immunity is usually with serious illnesses, and they shouldn't fast anyway, because most of them are likely that their illness itself will get worse if they fast. So there's a chance to feed poor people. So it's not, you're not getting reward. You're going to, people will get the same reward because they will be feeding one person for every day, and that's subhanAllah, will be still beneficial, even more beneficial than us fasting. We save money on our budget, but they actually feed others. We have, I think, 2 minutes to go before we finish the session. Sometimes it stretches to 45 minutes. Any more questions? Quick one.
Yeah, Assalamu alaikum. Assalamu alaikum, Dr. Ghannam. Just wanted to ask, what would you be advising pregnant women with diabetes about fasting, especially if they are on medication? I have patients who say that they are very comfortable fasting and they want to fast. So I find it difficult to kind of advise them one way or the other. What is your opinion?
There's two sides to this. One is being pregnant and the other one is being diabetic. Diabetic, I did broadcast and advise before Ramadan on diabetes. The certain type of diabetes, like type 1, who need insulin, they unlikely to be able to fast.
No, not type 1s. Not type 1s.
Type 2, when they are, there's two types of type 2. One is controlled by diets and medicine reduces the absorption of sugar and things in the intestine. They could fast with no problem. The problem will be if they take medication to reduce the blood sugar and the blood sugar go low during the day. So that is a risk, a high risk, and they need to check. I have a friend actually who showed me his results. His blood sugar is 81 by suhoor, and it's 110 in the afternoon and lunchtime. So what's happening now? He takes 2 doses, one at suhoor, one at futur. The futur one, between futur and suhoor, very short time. So by suhoor, he gets hypoglycemic. So need adjusting his medications, so he will get lot less dose at suhoor. When you are pregnant also, there is not many risks with the baby, because many people are fasting with no problems. But there's some women are afraid that they need probably to, make sure the baby is fine and things. And they need really somebody to see their physical state, and without diabetes, could they stand the fasting, and then physical state with diabetes and with the combined, and then advice. It's case by case, case by case basis.
So is it okay for them to be testing their blood sugars during the day?
I think they should, because it's a long